This presentation is on breastfeeding and diabetes prevention. At the end of the presentation, students will be able to understand the importance of breastfeeding and diabetes, understand and educate their future patients about the benefits of breastfeeding, understand the importance of breastfeeding for both mother and infant, understanding the components and biochemistry of human milk, as well as provide an understanding of breast milk versus milk substitutes. Worldwide, only 38% of infants are exclusively breastfed. In the United States, about 75% of infants are initiated into breastfeeding at the time of birth. However, by the third month of life, 67% of those who initiated breastfeeding rely on infant formula for some portion of their nutrition. By 6 months, the population decreased to about 43%, with only 13% meeting the recommendation to breastfeed exclusively for the first 6 months of life. The decision whether or not a mother chooses to breastfeed is documented to have various factors. Those include ethnicity, as well as the age of the mother at the time of the birth. Infants born to mothers who are 30 years or older were most likely to initiate breastfeeding at about 78%, while infants born to young mothers who are less than 20 years of age were least likely to begin breastfeeding. Slightly more than 69% of infants born in 2006 to mothers ages 20 to 29 were documented recipients of breast milk. Women with gestational diabetes and obesity are at an even higher risk of failure to initiate breastfeeding. The World Health Organization's first global report on diabetes states the number of adults living with diabetes has almost quadrupled since 1980 to a stunning 422 million adults. Type 2 diabetes results from the body's ineffective use of insulin and accounts for most people with diabetes around the world. Gestational diabetes, however, is a temporary condition that occurs in pregnancy and carries long-term risks of type 2 diabetes. The condition is diagnosed when blood glucose levels are above normal, yet below values diagnostic of diabetes. Women with gestational diabetes are at an increased risk of some complications during pregnancy, delivery, as well as their infants. The prevalence of overweight and obesity in women of childbearing age has risen all over the world during the last decades and has been attributed with a higher risk of pregnancy, obstetric, and neonatal complications, including greater challenges to initiate breastfeeding after delivery compared with those women of normal weight. Overweight and obesity are strongly associated with diseases that include diabetes, hypertension, high cholesterol, heart disease, stroke, arthritis, and certain malignancies, resulting in the number of weight-related deaths at an estimated 2.8 million deaths per year. Previously, primarily middle-aged and geriatric populations were affected. However, type 2 diabetes now occurs more increasingly in children and young adults. The World Health Organization warns that type 2 diabetes is often undiagnosed, and studies to assess the number of newly occurring cases are complicated. Consequently, there are almost no data on true incidence. The occurrence of undiagnosed diabetes in pregnancy and gestational diabetes varies among populations, but is suggested to affect an extraordinary 10 to 25% of pregnancies nationwide. Breast milk has been consistently cited to improve the metabolism in mothers and their babies and offset many of the previously named detrimental effects of diabetes. It is important that early initiation, which means providing the infant with the mother's breast milk within 1 hour of giving birth, and exclusive breastfeeding thereafter, should be highly encouraged and strongly supported. The American Academy of Family Physicians makes the following recommendations. Breastfeeding is the physiological norm for both mothers and their children. Breast milk offers medical and psychological benefits not available from human milk substitutes. Therefore, the American Academy of Family Physicians recommends that all babies, with rare exceptions, be breastfed and/or receive expressed human milk exclusively for the first 12 months of life. Women who are mostly at risk are those with excessive weight gain, a positive family history, sedentary lifestyles, poor nutrition, and those receiving drug therapy to control their gestational diabetes during pregnancy. The benefits for mother and child through breastfeeding for women with obesity and/or gestational diabetes are highly important due to breastfeeding reducing the risks of developing type 2 diabetes in the mother postpartum. Additionally, it was found that mothers who give birth to babies who have gestational diabetes may also have reduced risks against childhood obesity and diabetes through receiving breast milk. A few of the documented benefits for a mother and child include uterine involution, mobilization of energy stores, the reversal of metabolic adaptations of pregnancy involving minimized atherogenic blood lipid profile. It is also well documented that the biochemical content of breast milk is directly influenced by the child feeding at the breast, therefore changing with the needs of the infant. Breast milk contains all the nutrients a newborn requires in the first 6 months of life and is well documented both by the World Health Organization as well as UNICEF. Benefits of breastfeeding for moms include lower risks of certain cancers, including breast and uterine, faster weight loss and better glucose control, reduced breast cancer risks. Breastfeeding changes the brain for the mother through healthy hormone production, which then increases the ability to multitask and reducing memory problems. Also, a decreased risk of a developing metabolic syndrome in women with gestational diabetes has been documented. Also, breastfeeding exclusively has been documented with reduced incidences of both type 1 and type 2 diabetes in both mother and child. The infant's benefits include decreased morbidity and mortality from respiratory, GI infections, as well as decreased risk of SIDS. Breastfeeding provides optimal nutrition, and it improves the outcomes for premature infants. Here are some fun facts for you to read over. Some of the evidence includes human milk having a unique biochemical composition that cannot be duplicated at this time in synthetic infant formulas that are designed to replace biologically formulated breast milk. Scientific evidence clearly demonstrates that unnecessary feeding increases health risks to mother and child. Exclusive breastfeeding in the first 6 months of life has been documented as the best infant feeding method, providing physiological and psychosocial benefits for mother and child, quintessential nutrition for proper growth, prevention of adult obesity, allergy prevention, and immune-related conditions. Failure of breast milk production will necessitate infant formula feeding, in which the milk protein is associated with the risk of developing obesity and both type 1 and type 2 diabetes. In conclusion, the sole suckling of the child can influence components of breast milk from feed to feed, matching the ongoing changing needs of the growing infant, making this in turn the true optimal nutrition for an infant in the first 12 months of life. It is possible that the beneficial effects of breastfeeding may contribute to breaking the cycle of overweight and diabetes, which may occur among children of diabetic mothers. Thank you.